A very good morning and welcome back to Havana Media. My name is Boniface Awino, and as usual I'm going to be your host for today. Now, my friend normally say that I'm going to be your host for today. We don't know tomorrow.
Yeah, for sure.
Tomorrow will plan itself. So, okay, I want us to discuss something different from, it's related with politics, but it's kind of bit different. Because it's something that is really affecting the lives of people. It's not about, oh, Gachagua was done this, William Ruto has done that. No, we're not talking about that today. I want us to talk about the issue of health. Because this is one of the major things that is affecting people currently in Kenya, because people are asking themselves a lot of questions that why is it that we transited from NHIF, now we are on Shif, all that, and things are not working the way they're supposed to work, and leaders and CEOs are also being suspended. That is why I decided to invite Professor here so that we can discuss about this based on the knowledge that Professor has on this issue relating with the current job that he has just acquired at Uzima University, being the DVC of Uzima University. Prof, welcome.
Thank you very much, Boniface. So the most important thing that we have to understand here is that since Kenya Kwanza came to administration, they have changed a lot of things. Remember, for example, the university funding model has been changed. Of course, when they came in, the education system was changing, CBC. We have seen now KRA is now being transformed from Kenya Revenue Authority to Kenya Revenue Service. We've seen a lot of things changing, even names changing. Now you're talking about the issue of NHIF to SHA and then to Shif.
Yes.
So the question which is being asked, even the impeachment of the former deputy president to a now new deputy president, the questions Kenyans should be asking is that, are these changes helping them to have better economic development? Because there must be a distinction between economic growth and economic development. Economic growth is how much revenue you can collect in terms of taxation. Now you see, for example, the figures grew during Kibaki's time from Moi. It grew from Uhuru's time from Kibaki's. Now it has grown from Uhuru's time to Ruto's. When you hear the GDP will be growing by 5.5%, you celebrate, but you don't know that that means that the government will collect more money. But that's economic growth. Economic development is how is this money used to bring in education, access to healthcare, the issue of cost of living. How does it use to create jobs for people? How does it is it actually being used to people to access free healthcare, free education, and of course have living standards? So with those changes, we are asking all these changes we've seen happening around, even if you talk about the formation of broad-based government. So all these things coming together, are they cumulatively contributing to people's access to goods of life? Access to goods of life. Goods of life is education, healthcare, food, clothing, and everything. And as an economist, I've always been called the people's economist. If you want to see poverty, as an economist, it's very easy to see poverty. See by your eyes. Do this, just take a drive or a walk or a run along Lavington. You never see anybody airing clothes outside. You won't see people, you won't see clothes too much outside. You won't see food being paraded too much outside. And when you see food being paraded a lot outside and the clothes being paraded outside, means that people there mostly consume basic needs, meaning that they don't have any disposable income, let's say surpluses. If you come to Lavington, you don't see people, Westlands, you go to Karen, you don't go to Kleleshwe, you don't see basic needs being paraded outside. But drive along Outer Ring Road. When you see those apartments, you see clothes all over the place. They're being sold bananas, oranges. People are eating maize, everything. So when you see people are spending most of their money on basic needs like food, clothing, and housing, it means they're poor people. Rich people should not be spending more money. So it means that in spite of all this growth, in spite of all these changes we are talking about, we have not seen consumerate changes in people's lives. Because the way I used to live in Kibra, the same way it looks like people are selling clothes, a lot of clothes, food, selling second-hand clothes, some of them in very desperate situations. You say that government has not been able to inject this money into people's lives to really alleviate the poverty levels that people are suffering. Even now you are seeing that they are taxing that money. They're telling you the GDP is growing, yet the information is showing that 3,000 companies are folding shop because of the economic situation. G4S is going to, has actually declared redundancy. Tiles and Carpets, which talks about the big annual sale. The big annual sale, they are going to lay out hundreds of employees. So as the economy grows, we should see the consumerate economic development. Development's about freedom, access to goods of life. So that's not happening. So even Shah and Shif was supposed to ensure that more people can access healthcare, but also more people can be employed in the healthcare sector. Is that happening? Story for another day. But two things that we want to discuss in this segment. First, what is the opportunity for healthcare in Kenya? Because now we are seeing healthcare as a burden.
Yeah, it's like a burden. Everyone is crying.
We are not seeing it as an opportunity. As a scholar and as an academic and as a leader in the academia, I've looked at the healthcare opportunities in India because I was in India for 6 months working with the Reserve Bank of India on how to bridge the gap between the poor and the rich, especially on the access of financial services. And there's something that can actually maybe just surprise you. And these are the statistics. Can you imagine that India exports healthcare?
They export.
Yes. And what I might mean, India has earned a total of 26 billion USD in exporting pharmaceutical products and vaccines. Did you not hear when Raila Odinga was campaigning and Ruto was campaigning? Both of them went to India, even Ruto was in India in December, to look at the pharmaceutical manufacturing sector in India to see what we can do. Can you imagine if we can be able to earn $27.9 billion US dollars in exporting pharmaceutical? Will you have to borrow money from anybody?
No.
The second thing which will shock you, and this is even the most shocking one, have you heard about health tourism in India?
Tourism.
Where people go to India to be treated. Like when you have cancer, mostly people go to India.
People go to
As you stay in the room there, because I was talking to my friend yesterday, his name is called Munyao, Joseph Munyao. He was the CEO of Musoni Microfinance Insurance, microfinance company. I used to train him there. I even helped him develop the strategic plan for Musoni. Then he went to work for another micro insurance company in Uganda. Now he has set up something which we are going to visit with you. He's just along outer this Kilimani Ring Road here. We are going to visit. He has set up something. He was very happy with the last interview we did. He said that it was very informative. So he told me that he stayed in India for 1 month getting treated. And people go to India for this. So imagine in the last 10 years, India has earned $7.4 billion US dollars in health tourism. So those Kenyans going to India for treatment, plus other people from other countries, have given India an export of $7.4 billion US dollars in terms of revenue.
Like make me understand here. So when someone goes to India for treatment,
yes,
now the person is gone there like he needs to heal healthcare.
Yes.
And then so the Indian government sees this as a way of tourism.
Yes, because you see when you go there, you see if you go to India, they don't do what we are doing here, rushing to give medicine. You go to India, like this guy stayed for 1 month. Where you are being given out of diagnostic. I'll be going there much later on. So I'm trying to make you understand when you go to India to do this, you are going to consume their accommodation. You are going to consume their food, isn't it? Also, you are going to do sightseeing and you pay for it because also they tell you, to be healthy, also you need to see at least the statue of Mary. You see a monument, isn't it? So also makes you feel nice. You look at the Indian culture because also treatment is also spiritual. So India has earned in the last 10 years, $7.4 billion US dollars. And the project in the next 10 years, they'll be earning $43.8 billion. Now I'm trying to say, why are we playing with our health sector when this is the potential, the opportunity? So as a leader as a leader in a university which is focusing on health sciences, I think I would like to contribute something to my country by coming with a vision, because Kenya can manufacture medicine. We have industrial area where people want to manufacture. We have manufacturers in Kenya who want to manufacture. What if we start exporting our medicine and earning that money, $27.9 billion from exporting pharmaceuticals? The president was with Meg Whitman met, and Meg Whitman was talking about the issue of setting up pharmaceutical manufacturing in Kenya for Kenya. But that has not happened. These are opportunities that are standing in the way. So instead of the government of Kenya just looking inwards, why don't we look
out,
inside
and out?
Yes, inside outwards. That instead of making money only with the 53 million Kenyans, Eastern Africa, that Uzima University belongs to, has a population of over 500 million people. Now, Raila Odinga is going to become the chair of AUC, isn't it? Look at the population and opportunities that can bring if we just strategically position ourselves. Because people are looking at these things in terms of political, ODM versus UDA. Those are small thinking. You know, leadership is about creating a highly compelling vision. Because leadership is not about just taking care of what you have. If you just get these 50 million people, they are the people you tax only, you work with, then you look like a caretaker. A caretaker is not respected by Jesus, because he just talks about the story of the talent. When you're given one, make them two. When you're given three, make them six. 5, 10, multiply. That's what leaders need to do. Don't behave like a caretaker. If I give you to be in charge of my house, you can tell me, hey, Fred, when you left, you had a 3-bedroom I was charging people. Now I built a servant quarters. You can earn another 5,000 shillings. That's leadership. So I'm asking even members of parliament, as they deliberate the issue of health, of Shah, Shif, and the rest, let us not just be very myopic about who stole the money, where is the money coming from. Of course, those are key. But this sector has potential to generate for Kenya, I told you, 27.9. If you add there 7.4, isn't it? Those figures around 40.
That is around 40.
40.6.
27.7. That is around. That is 34. 34.
Yes.
Yeah. So let's say 35.
35.
Yeah.
35
something.
billion shillings. $billion.
Yeah, $1 billion.
If you multiply that by Kenyan shillings, you can finance at least a third of the Kenyan budget without worrying anything else.
Without even worrying borrowing.
But how many jobs will you create? When you create more jobs, people can afford school, so they can take their children to school, and then they can be able to pay more taxes, and then they can buy more houses. They can be able to buy a sofa set. They can buy shirts. They can buy clothes. They can buy shoes. They can buy belts. They can buy a tie like you. Can you imagine if 30 million Kenyans can afford a tie? Do you know the people who can sell ties in Kenya? A lot of people. So I'm talking about strategic opportunity that Kenya can bring. So that is an important thing, that the opportunity which exists, but it cannot work until the healthcare system in Kenya is clean and lean. So that's what I learned in India. When you go to India, like this friend of mine, he spent around 1.2 million Kenya shillings in India for 1 month, which includes accommodation, treatment, which also includes surgery, isn't it? Among just also doing that tourism. In Kenya, to stay in an hotel for 1 month might actually have eaten the whole 1 million. Doctors will charge you through an arm and leg. And there's a story he told me which was so moving. He met another Kenyan who had worked for Kenya Power for a long time. He said that man went to India and the wife was carrying a bag of medicine, bag of medicine. So
with her to India.
Yes, because see, in Kenya, when you reach the hospital, immediately you arrive, they tell you, start taking this medicine, even before they know what you're suffering from. So we take too much medicine. And I told you last time, the segment we had the other day, about lack of precision medicine.
That is why doctors give you too many medicines.
So it's not just that, but also there's a moral issue to that. You see, these doctors also, they are sales managers for pharmaceutical companies.
Okay.
So when the pharmaceutical companies want to make money, there is what we call selling using specifiers. Specifiers is that if I come to you and tell you, Bon, I want to set up a studio, you tell me, use this brand, which means you are selling that brand on behalf of the manufacturer. So when you go to hospital, do you know why doctors can prescribe one medicine but not the other? Yet there are several medicines in the store that treats the same thing. In India, they don't do that. They give you something which is called hereditary test and then genomic test. Hereditary means they look at your heritage. Who is your father, mother, the gene transfer. Then they know this medicine will do better with you than this medicine given your family history. Then the other one is genomic test to know what is your gene, what's the component. They tell you this medicine, if you take, it will work this way. So for us in Kenya, the Russians say, oh, this is malaria. Okay, take this one. Chukua Panadol. And they start giving Panadol even before testing. So I believe that there must be some revolution, again, opportunity here for Kenyan government with the Shif and the Shah. If we can improve our diagnostics to ensure that we treat the right illnesses, the cost of medicine of Shah, Shif, and all insurance companies should go more to diagnostic than to buy medicine. Because when you buy more medicine, you do less diagnostic, you're not treating the patient. Because the treatment is to know what is the problem.
What exactly the problem?
When the diagnostic is properly done, the treatment is fully, almost 90% done. So when instead of rushing to give medicine, why don't you put more money on diagnostic to get the diagnostic right? How many hospitals are operating without even equipment for diagnostic? So on what basis are they treating people? So if the Kenyan government comes up with a policy upon which we can improve our diagnostics, so that we treat our children, we treat our mothers, we treat our fathers, the elderly people are treated based on what is their problem. It can work. So imagine, in this guy who was carrying a bag of, the wife was carrying a bag of medicine, he said that one of the bag was carrying medicine for diabetes.
One of the bags?
Yes, one of the bags. Where he was taking, after every 3 hours, he's taking medicine because of diabetes. So when this person was tested in India, they told him, no, please. You have diabetes, yes, but your level of diabetes does not need medicine. You need to do what's called just exercise and diet. Exercise and diet. So the doctor told the wife, do not give your husband any more medicine after every 3 hours. And don't give at all. And the doctor told this one, if that person dies, come to me. So immediately, the doctor put this person on diet and on exercises. His diabetes was managed. But here, because someone is a sales representative of a pharmaceutical company in the name of being a medical doctor, they could easily be able to tell you, you take this medicine, take that medicine, take that
and
medicine.
then they give you exact place to get it, assuming that it's not there.
Yeah, so these are moral hazards in healthcare. So I think that I'm talking about the clean and lean system. Clean and lean. The government may need to have some people who are very ethically sound that can be able to direct people that you are spending most of our money on this medicine, yet what you need is diagnostic. Because after the diagnostic, no medicine. Like this friend of mine, he told me after his diagnostic, he was told, no medicine for you. You are well, but we're just going to perform a small surgery. We'll just cut some tumor, remove it off, and you go home. No medicine. He was expecting to carry medicine where they should even come with the luggage, that luggage. And he carried nothing. So I'm trying to say that is a serious issue. And that's why at Uzima University, we are going to set up a morally compliant medical courses that complies with the moral standards, whereby there are some things you can't do. For example, is it allowed for you to give somebody a medicine called euthanasia? Because also people who manufacture medicine for euthanasia talk to doctors to issue it. Abortion. The Catholic Church is totally, our position is that no abortion. Yeah. I don't care about the Democrats pretends that you should do whatever you like with your body. No, you cannot do whatever you like with your body. Your body born is given to you by God. It's a creation, a gift from God. You can't do whatever you like with it. Of course, we are not telling you that God must control you on what you do with the gift he gave you.
Yeah.
But respecting what God gave you, is why we say your body should be the temple. So you cannot start saying, for example, Democrats say that when you are born, they cannot say that, hey, you look like a woman, you should change to a woman. So they give you a gender. No, gender is assigned by God, because according to the Bible, God knew you when you are in your mother's womb. When your bones were being formed and being put together, God had identified you and your gender. No one can assign you gender post-birth, because that person now trying to be God. God created Fred Ogola. God created Boniface Owino as you are. Yeah. And God said, everything is good. Now, this person who's seeing something is not good and wants to replace it, where are you coming from? So we also have to keep what's called ethical medical training. So our medical doctors, nurses must be standard of some ethical background. I think these are going to be very serious discussions that we shall be able to discuss with the faculty, also involve students to participate. Yeah. But we believe we cannot have a country where everything goes. Relativism is evil. There must be some absolutes here. So that is something that we want to find out, that this medicine people are taking too much does not happen. Then thirdly, if you go to everybody's home, I don't know how your homes look like, but my house also could be the same. You go to people's drawers, they are full of medicine.
Yeah, that's true.
Taken, to be taken, will be taken, will never be taken. Now, if you have a medical insurance through Shif or any other private insurance, most of the time you go to hospital, they ask you, how are you paying? Once you say through insurance, they'll give you a lot of medicine, charge you very highly. They know very well that you don't need this medicine, but they are doing that to make money from the pharmacy. Then after that, you keep this medicine in the drawer. So billions of shillings is lying on everybody's locker. How many packets are in your locker? For me, even there's a time I went with my son to also, they give him a breathalyzer. Something for breath, saying, sometimes he might get asthma. I don't know, my son has no asthma. But he was given something that in case.
Just in case.
And because I was paying through medical insurance, they said, just take it. It's for free for you. The insurance has paid for it. Now, the government should come up with measures upon which these moral hazards can be taken away. Then we save money. Instead of putting a lot of money on medicine, we put money on diagnostic to know what is really critical. So that means that if that money is available, we need to buy very high-end diagnostic equipment, because I told you before about the silent revolution in healthcare. Before, people spend more money in the bed, on food, and on drugs to get well. But nowadays, people spend more money on equipment, technology that can diagnose you quickly. And some of the technologies now, even when they are doing surgery, surgeries are not supposed to be so strong that once you have a surgery, you stay in hospital for 1 month. Nowadays, you can have day surgeries. For example, we are dreaming of a teaching and referral hospital in Uzima. We'll have a high-tech hospital where you can have day surgeries and you go home. And do you know why the medical services in India are cheaper? They do what's called online booking. Let's say, for example, there's a hospital which is being based around here. They can bring one of the most qualified surgeons to come here. Then they book 200 people to come here today. This guy will perform 200 surgeries in a day, because his work is to cut, amend, then somebody now will patch it up as he goes to the next one. And because of economies of scale, and because you have a team that is there together on the same day to do this in the same day, instead of some people sitting there waiting when a patient comes in or not, scheduling is not very good. If you do proper scheduling, you can do 200 surgeries in a day and people go home. So it's cheaper for the hospital, and therefore they transfer the cost now benefits to the client. So with the technology, with booking, with scheduling, if you amass all this with how insurance companies work, lean and clean system, remove all the moral hazard and focus on treating people, that's what has made India cheaper than Kenya. That's why when you just get sick, all the machines are here. They are in Aga Khan here. But somebody prefers to go to India and it's cheaper. Flight, including accommodation. Here you are being treated and you are going home and you are not recovering as much.
You can take
isn't it?
Uber.
So I'm trying to say I'm not saying Kenyan doctor, by the way, most Kenyan doctors work in the US, work in UK, they're highly qualified. But there must be a challenge of systems not being clean, not being honest, not being lean. Everything is too expensive for no reason.
Yeah.
And Kenyans need to have these things whereby when you see anybody, you want to rip them off. Everybody want to double their prices.
Yeah.
How much is your phone? They say, how much can this guy pay? This guy can pay 3 times. Let me give him that price. And this is across the board. Let's be very honest, straightforward. That's why in Kenya and Africa, there's a lot of bargaining. You know, when I was in Spain, there's a time I went to look for a house to rent. Then someone, my landlord to be told me, this house is $700 a month, euros a month. I told them that, can we do 500?
You are bargaining for a rent.
Yeah, you see, actually, I didn't say, can we do? I said, I have 5. I told you that I'm not interested in what you have. Me, I just know the house that is 700. You may have more. So why do we have a culture of bargaining and haggling? Because you believe no one is honest.
Yeah.
So everybody wants to rip you off. So you go to school, you bargain. You go to the bus, you bargain. You go to the shop where supermarket prices are written. You're still looking for, can I bargain this? So some people can never buy in supermarket because there's no bargaining.
They have got the bargaining spirit.
Yeah, so everybody is bargaining for everything. You go for dowry, you bargain. Of course, also, let me be honest by saying bargaining is our African culture. So let's take it for it. But it has got the side that needs to die where people want to rip others off. And the side actually that need to stay. So what I'm trying to say here that there's a lot of opportunities that can be able to transform healthcare. And the Kenyans taking their money to India, being eaten by Indians, while for us here we are busy being overtaxed and we're not seeing the benefits. We need to transform it and transform it as a whole. So now, before I allow you to ask me another question, the second thing I want to talk about was the issue on how SHA and Shif was implemented, because that is what is causing the commotion in the country. You understand me?
Yeah.
That is what is causing the commotion. I can say that there was a red flag for me. You know, the red flag was clear. One, there was asking for more time to fine-tune the process. No, when they wanted to launch the SHA and the Shif, they say, we want to launch this day, but give us more time, we fine-tune the system, isn't it? When you see people trying to fine-tune system, it does not work. I'm sitting here, I'm just from tender opening. I gave my tender in the morning. The opening was at 10 a.m. And at exactly 10 they open. They only use what is inside the tender box. If you come 1 minute later,
you are late.
No way. So when someone says, let's now open at 10:15, you must know something is happening, isn't it? So this thing, when they said we want more time to fine-tune the system, you could see a red flag. Another red flag was the postponement of the rollout twice. It was postponed twice. What was happening? What was being cooked at the background? So that was a red flag. The other one was last-minute leadership changes. After they set up everything, then all of a sudden, they're changing the board, they're changing management, the CEO. What was happening? Maybe there was a cartel that had infiltrated, or there was a cartel that needed to come. And I see these changes, always someone changing to his own cartel.